The front line in the fight against coronavirus. The Brooklyn emergency room of SUNY Downstate Health Sciences University. Patient after patient struggling to breathe. This morning has been brutal.
Today is pretty intense. We've had a bunch of people die in a very short period of time, which we, are prepared for. But when it happens so many times in one shift, it's pretty hard to tolerate.
As we arrive in the ER, the latest victim of coronavirus at SUNY Downstate is being wrapped up in the emergency room bay where doctors try to save them. We visited SUNY Downstate for about 3 hours midday Friday. In the short time we were there, in the emergency room alone, 6 patients coded. In other words, they suffered heart or respiratory failure. 4 of them died. A devastating part of just one day.
This is what we trained to do. This is what we signed up for, just not in this volume. You may have a code, maybe on a bad shift, you may have 2 codes where you carry that emotion and you wonder if you did everything that you could. I think it's emotionally hard to prepare for this level of sickness and suffering and morbidity and mortality in such a short period of time. I don't think any of us are well prepared for it.
Have you ever seen this ER jammed like this?
Not quite like these days, no.
You're not at max yet, but you're pushing it.
Yes, we're pushing it. So at times, the emergency room here, there is no room to move, but we have a system of where we decompress them out. Behind here in the hallways are other rooms. There's the fast track. Not many people have been bringing in their children, so we've taken over part of pediatrics. There's also clinics back here that we can turn into beds, and they wait there once they're stabilized from here and then go upstairs.
The corridors in the ER here lined with those suffering from coronavirus. Patients unresponsive, struggling to breathe. It is the hard reality of this virus. For some patients, it attacks the lungs, depriving them of oxygen, slowly suffocating them.
With COVID, the pneumonia is not just in one lung, but rather in both lungs, leaving the patient with no good lung. And it's also widespread throughout both lungs with a massive inflammatory reaction that's damaging the lung.
Keeping the most critically ill patients suffering from coronavirus breathing, it is as simple as it gets in medicine, but still a mystery as coronavirus resists treatments, confounds doctors, and kills patients.
Here, in terms of the airway, we have to manage their airway once they become so altered from the lack of oxygen that they're unable to keep it open themselves.
And what is the mortality rate? Once they go on a vent, what happens to mortality?
It increases exponentially.
More patients die, in other words.
They do. The numbers are not exactly the same from country to country, and there are various factors for that. But we all agree that it skyrockets. This is showing that there's some fluid in the lung.
Dr. Lorenzo Palladino is an ER doctor who has done groundbreaking work on putting more than one person on a single ventilator. It's research he hopes that will never have to be used here.
What keeps us up at night is precisely what motivates us to do that kind of research here at SUNY Downstate, is that we want an alternative to give to these patients. Not just the ventilators, but also for CPAP in isolation, oxygenation, high flow. We try all sorts of maneuvers in order to keep them breathing and keeping them from suffocating or having a cardiac arrest.
Code 99, code 99.
And it's not just in the emergency room where patients struggle to breathe and code.
Code 99.
While interviewing doctors in other parts of the hospital,
Code 99.
nearly constant overhead announcements
Code 99, code 99.
that another patient has coded.
Room 815.
Those announcements for patients already admitted, not those in the ER.
Can I just stop you for a second? This
Nursing station 62.
This is the 5th or 6th code 99.
Code 99 is typically a rare event. We're having, I would say, 10 code 99s every 12 hours at least.
Well, we've been here for about 30, 40 minutes, and that's the 5th or 6th one.
And a lot of that, what that represents is calling for a team to put an individual, a patient on a breathing machine.
What is most jarring about seeing the inside of an ER and hospital making the transition to being one of 3 in New York State that will only treat patients suffering from coronavirus? Outside, it is quiet and feels like an early spring day.
It's slow moving and is damn boring for a lot of people, but this is a disaster.
This is definitely a disaster. It's kind of difficult for people from the general public who don't work in the hospitals, because when you drive down Clarkson Avenue, you're driving down New York Avenue or Nostrand Avenue, which are pretty busy thoroughfares. It's almost crickets, but then here in the emergency department is the level of intensity that you only see in disaster zones that have been televised around the world.